flu season has arrived, and I'm joined here today with Dr. Vivian Sardone, who's here to share some tips for keeping you and your family safe this season. Dr. Sardone is an internist at CU Medicine Women's Integrated Services and Health at Park Meadows, also known as the WISH Clinic, which focuses on holistic women's health care. Dr. Sardone, it can sometimes be difficult to tell the difference between a simple cold, the flu, or COVID. What advice do you have for patients this season trying to figure out what they have?
Trying to distinguish between a simple cold, the flu, and COVID can actually be really difficult. And to be completely honest, it doesn't really matter because our treatment for colds, the flu, and COVID is all supportive care. Now, if you have certain medical comorbidities like high blood pressure, diabetes, or you're very, very ill otherwise, you would kind of be at more risk of developing a more severe infection, in which case I would want you to be seen by your primary care provider. But we really focus on supportive measures and symptom control. The latest strains of COVID that we're seeing out now are really more similar to the strains of the flu that we've been seeing for the past several years. So our treatment approach is very similar. So with that respect, it doesn't necessarily matter that we know exactly which virus we're dealing with. The only definitive way to know is actually getting a test. So if you really do want to know if it really would matter, let's say you're a teacher or you have a job that involves a lot of face-to-face with interactions with people, the best way is to test, and you can do that by scheduling an appointment with your provider.
So what preventative measures can families take?
My favorite preventative measure for the flu and for flu really is getting your yearly flu vaccine. So the vaccines are not perfect. No vaccine is, but the whole idea of preventative vaccines is to kind of provide enough protection at the population level so that we can keep the virus at bay, keep it from causing very serious outbreaks. Other preventative measures you can take is practicing good hand hygiene. So making sure you're washing hands with soap and water, especially after you blow your nose, covering your mouth when you cough, doing the vampire cough. These are all ways to help prevent the spread of these kind of contagious diseases. But again, I'll go back to vaccines being the best way.
What supportive measures can patients take at controlling their symptoms?
So some of the things I like to recommend for managing symptoms at home are making sure you're staying well hydrated with things like water, soups, broths, electrolyte mixes. Coconut water is great. It has a lot of electrolytes. And I also recommend drinking hot water with tea and lemon. That can help calm some of the inflammation and some pain you might have in your throat. And I also do recommend things like over-the-counter remedies. Flonase, Dayquil, and Zyrtec can actually be very helpful to take, especially if you have seasonal allergies. You might find that you get worse symptoms with a simple cold or a flu.
Let's talk about preventative, so what are some ways that we can boost our immunity naturally?
So some ways to boost your immunity naturally is making sure your diet contains enough fruits and vegetables. Vitamin C is a really important vitamin for bolstering the immune system. And it can be found in a lot of citrus foods and leafy greens, vegetables, fruits. So I think diet is a great way to boost your immunity. Exercise has actually also been shown to help people have a more robust immune system. So making sure you're getting regular cardiovascular exercise and weight training can really help you stay healthy. And then sleep is so important for keeping our immune systems active. So really aiming for a consistent amount of sleep each night can help keep you healthy.